I'm glad that you all had a delicious lunch, and I'm really delighted to be in San Diego, especially to hear Supervisor Roberts talk about all of the wonderful things that they're doing here to address childhood obesity. I want to welcome you to the Childhood Obesity Conference for 2011. I'm Linda Rudolph with the California Department of Public Health. It's fantastic that so many of you appreciate the work of our department. I want to thank our co-hosts for the conference, the UC Berkeley Robert C. and Veronica Atkins Center for Weight and Health, the California Endowment, and Kaiser Permanente. This conference is also made possible because of the support of our other major sponsors, Anthem Blue Cross, the W.K. Kellogg Foundation, and all the sponsors that you see listed up here on the banner behind me. Thank you for your support. We all know that a conference of this magnitude and this quality is the result of the work of many individuals. California Department of Education contributed enormous staff resources to the planning of this conference, and the conference program lists the many agencies that support the conference by allowing their staff to volunteer their time, expertise, and enthusiasm to this effort. With all those, I'd like all those that participated in the planning as part of the executive committee or the planning committee or the track work groups to stand up so that we can just acknowledge the work that you've done to pull together this incredible event. For those of you who are younger than me and more adept at social media, if you'd like to tweet about the conference, the hashtag is #COC11. And we also have a Facebook page, and we welcome you to post to our wall or upload photos of the conference activities. The richness and diversity of those who attend this conference continues to grow. This year's conference has an attendance of nearly 2,000 people. It's the largest gathering of professionals focused on the prevention of pediatric overweight in the nation. And the people in this room represent a multi-sectoral array of professionals from public health, healthcare, people from community-based organizations, education, advocacy groups, agriculture, business, land use and transportation planning, and research and academia. I thank all of you for your dedication that got you here, even in the face of very difficult economic times that every organization in California that works for the public good is facing right now. And I know that you all have a lot of competing priorities. It's more critical than ever that we address the challenge of childhood obesity today as more families struggle with limited food budgets and communities struggle with fewer resources. So our collective coming together to continue this work is more important than ever. We have a lot to be proud of. This year's conference theme, Celebrating Success and Moving Toward Health in All Policies, will be acknowledging these successes throughout the conference. As an example, we see significant grant opportunities by the federal government that allow more focus on policy and environmental changes that influence healthy eating and physical activity. Many communities in California and throughout the nation are using their American Recovery and Reinvestment Act grants and Communities Putting Prevention to Work grants to address childhood obesity and related problems. And in fact, there's a session tomorrow morning that will talk about some of those successful efforts. We've seen vastly improved food and beverage offerings at schools and at child care facilities. We've seen a greater focus on community planning to encourage more walking and biking. We've seen more communities and states adopting complete streets, more communities engaged in safe routes to schools, and more work to preserve green space for parks and trails. We've even seen Jack in the Box agree to drop toys from their kids' meals. And perhaps most importantly, we're seeing a shift in how obesity is framed by the media, by government, and by people in every community, moving away from it being viewed only as the individual's responsibility to having more understanding of the ways in which childhood obesity is largely addressed by the environment. So I want to spend a few minutes talking about one of the key themes of this conference, moving toward health in all policies. What is health in all policies? Health in all policies, which I will refer to as HIAP for short, means incorporating health considerations into the decision-making processes of agencies that don't typically think of themselves as health agencies, and whose primary mission is something other than health, such as transportation, housing, education, or agriculture. The concept of health in all policies isn't new. In 1986, the World Health Organization promulgated the Ottawa Charter for Health Promotion, which recommended that health be, quote, on the agenda of policymakers in all sectors and at all levels. HIAP approaches have been incorporated into the governance structures of most other industrialized nations, including the European Union and many of its member states, Canada, Australia, and New Zealand. Health in all policies is also known as intersectoral action for health, joined up government, healthy public policy, and often HIAP happens without anyone naming it. Why do we need HIAP? I think we all recognize the magnitude of the challenges that we face as we try to address a slew of what we have been calling wicked problems, complex problems with multiple interdependent causes, political and values controversies, and no clear silver-bulleted solutions. Childhood obesity, poverty, inequities, immigration, climate change, these are all wicked problems, and they're all interrelated with each other, and they all require that we think differently about the way that we do our work. Some might argue that childhood obesity is actually a simple problem. It's all about the calories people eat and the energy that they expend, right? But we know that it's the countless factors that influence each side of the calorie in, calorie out equation that make obesity anything but simple. Public health agencies acting alone can only do so much to reduce childhood obesity, not just because of the resource constraints under which we're laboring, but because we actually have limited expertise and limited authority to address the key determinants of obesity. We all know that people don't live in a vacuum. What we do every day is largely shaped by the world that we live in, our neighborhood, where we go to school, the kind of work we do, what wages we make. These physical, social, economic, and services environments can make it easy for us to make healthy decisions every day, or they can favor less healthy choices. And the decisions that shape these environments are by and large made by agencies who are often only dimly aware of the huge impact their decisions have on health. Let's go back to our simple calories in, calories out equation and look at just a few examples of the environmental challenges that will be the subject of much of the rest of this conference. Research done by the California Center for Public Health Advocacy, PolicyLink, and UCLA using an index based on the ratio of unhealthy outlets such as fast food and convenience stores to healthy outlets such as grocery stores and farmers markets found that obesity rates are higher in neighborhoods with fewer healthy food options. But who decides what food and beverages are available in our neighborhoods, or how easy it is for us to get to a place that sells healthy food? No single person does. No single agency does. It's planning agencies and city councils that make zoning decisions, the economic development and redevelopment agencies that provide funding for certain kinds of developments, the transportation agencies that decide on the routes and schedules of public buses, the food distribution systems that make it harder or easier for small farmers to access local retail outlets. How much does healthy food cost? Again, no single person or policy determines food prices. Land use policies determine whether or not we preserve agricultural land to support sustainable local food systems. It's costly to ship food, both in dollars and in the climate change costs of food miles, the greenhouse gas emissions from transporting food. Sometimes, as Supervisor Roberts mentioned, even farm-rich areas don't have access to the fruits of their own region. San Diego and Fresno residents in public workshops that we've held with CDPH have both lamented the fact that local produce is shipped out of these very rich agricultural regions for processing elsewhere and then shipped back at higher cost and often in less healthy forms. Agricultural policies and subsidies play a huge role too. U.S. subsidies for commodity crops like corn make high fructose corn syrup and sugary beverages plentiful and cheap. These commodity subsidies also artificially lower the price of meat, consumption of which is a major contributor to heart disease and overweight. And parenthetically, livestock production is a leading cause of greenhouse gas emissions globally. Paradoxically, new subsidies for corn-based biofuels have driven up the cost of corn on the global market, leading to rising food prices in Mexico and Central America and putting increasing pressure on immigration. Is it starting to sound more like a wicked problem?